Well, when our very own Eddie revealed she had cancer, she had one message for you all: take care of yourself and check in with your doctor.
Yeah, Eddie's diagnosis came almost by accident following a regular checkup. After her 40th birthday, she had no symptoms and says if she hadn't have had that check, she would be dealing with a very different situation. So what are the simple but critical tests that really could save your life? Joining us now with everything you need to know is GP Dr. Sam Hay. Great to have you with us, Sam. So firstly, before anyone books a checkup, you say it's important for people to have a good relationship with their GP, like Eddie does. Why is that the case?
It is absolutely imperative to have a good relationship with your GP, because when you're unwell, you feel vulnerable. And when you're vulnerable, you feel embarrassed, there's shame, there's a lot of stigma about going to the doctor. So if you've been seeing somebody that you've developed a relationship with, when something difficult comes up, you're going to feel a lot more comfortable to go and talk about it and then get the care that you need.
So what tests should everybody book in with their GP right now?
So I really encourage people to go and start having a relationship with a doctor in their 20s, in their 30s, and then having those regular checkups. Now, a checkup is going to look for the most common things that cause problems for us down the track: heart attacks, strokes, diabetes. So we need to be checking weight, blood pressure, diabetes, looking at smoking, but then also family history, because what conditions your family have had is going to influence your risk. And then also the common cancers that are out there, and therefore the screening program. So when you're going to see a doctor, they should be looking at doing an examination, actually checking you out from head to toe, doing some vital signs, your pulse, your blood pressure, and then sending you off for a basic set of blood tests, but also specifically looking at diabetes, cholesterol. And then you've got your pap smears for cervical cancer, mammograms for breast cancer, and then there's the bowel cancer screening program, and then have a chat with your doctor about prostate cancer.
Sam, when should we start this and then obviously continue with regular checkups?
Look, I really encourage people to start checkups in their 20s, definitely 30s, and I get really frustrated if people haven't started in their 40s. I like people to be going and seeing the doctor at least once a year. Now, certainly, the more healthy you are with no risk factors for anything, we often can stretch it out. But if you stretch it out to 4 years, 5 years between visits, you haven't developed that good communication, that collaborative relationship with your GP. So when something does happen, you won't get the care you need.
Right, OK. Dr. Sam Hay, we really thank you for your insight. Good tips there.